Hi, I'm Dr. Shawn Keller. I'd like to invite the cameras into my office today so you can see how the dental implant process actually takes place. We have people who come in, literally they have no teeth that day, and they leave that day with a set of fixed teeth, top and bottom, that afternoon. Let's show you how that takes place. This is our reception area. Right when you come in, we want you to feel at home. We're coming down my hallway. You'll notice a lot of paintings around the office. I'm a painter. I like doing colorful art. I kind of put the same passion into designing smiles that I do in my artistry. There's basically two types of people that come here. There's the first type, the people that are headed to dentures, but they're doing everything they can to avoid the denture. And then there's the other people who are already in a denture and they don't even really know what their options are. And so hopefully with today what you see, you'll learn a little bit more about it and you can come in and see what we're about. Teeth are important, especially your smile. If you've met somebody who's not proud of their smile, or you wouldn't even know, they might try to cover their mouth when they laugh, or they might seem even grumpy because they're not even smiling. It might actually just be they don't like their teeth. When you don't feel good about your teeth, you're not really showing people your true self. If you're going for a job interview, or if you're with a group of friends, you might not be smiling, or you might not have the charisma you normally would. We find our patients here, after we give them a smile that finally feels more like it's them, but usually about a week or two later, you'll start to see them light up and this other version of them comes out. It's really phenomenal when you see it, and their family members tell them that they're a different person. It changes everything in your life. The other people that you know, when you're smiling more and you start becoming yourself again, they're nicer back to you and your relationships improve. I've been focusing on dental implants for the last 20 years. It's the greatest service that we can give to our patients. If you can take somebody without teeth and give them teeth, it's the best thing we can do. The technology is there. There are things that we can do today that we couldn't even do 5 years ago. With the stem cell therapy and the metal-free implants, it's amazing what we can do. The teeth look natural, they feel natural. They're actually stronger than real teeth. And with a 98% success rate, we hope that most of these will go to the happy hunting ground with you.
I'd had years of problems with teeth, having crowns that had failed, old dental work that was going bad, and getting to the point where it was hard to chew different foods and stuff. I was having trouble like eating steak, those kind of things, and there was no way I was going to have dentures. So I met with Shawn, talked with him about my options. Yeah, these are my teeth. They are there for good. They're going to last me forever, and I'll be buried with them. I eat steak. I can chew nuts. I can eat just any kind of food that I normally used to eat long before my teeth started to fail. So a lot of things that I missed eating for years and years, I can now go into any restaurant anywhere and just order what I want and eat it, and no problem.
So at our center, we're able to do it all in one day. Like literally you can come in that morning with no teeth and you can leave that afternoon with a full set of upper and lower teeth on implants that don't come out. So how do we do this? It has to do with our technology that we have. We have the milling machine right here. So it's all digital now. So we digitally scan your smile or your gums or whatever you have, and we design the smile right there digitally. Then we have the teeth out, or if you have dentures, we just use them as a guide on where to place it. We place the implants in the area where you have the best bone, and people who were told they don't have enough bone to even do this, you'd be surprised what we can do with today's imaging. We can usually find some there, and with the stem cell technology, we can actually grow some so that we can still get the implants in the same day. And then we mill the teeth right there, so you get a full set of teeth the same day.
We do metal-free implants in our office as well, and the best patients that we get are the implant patients. They are the happiest as well too. The fact that they come in with no teeth and we're able to give teeth the same day.
My teeth were getting really bad, so I was looking for options, and I was always told it was dentures, and that was not an option for me. I ran across Dr. Keller and found some options that he gave me. We went ahead and did that, and I'm eating steak and corn on the cob, everything that I love to eat. I smile a lot more, and I'm happy. It makes me, I look in the mirror every morning and I'm so glad I had this done and wish I would have had it done years ago.
We take a lot of photos in our practice, and And here's some of those. These are all people who were headed for dentures, and they were doing anything they could to avoid that. This is Lavanya. She's only 26, and as you can see, it's falling apart. It's not looking good, and her dentist told her she's headed for a denture. So she Googled us, and we were the first one to pop up for how to avoid dentures or no more dentures. And so she came to us, and we came up with a solution to have the teeth out, have the implants in, and have this new smile done the same day. This is the stem cell room where we do stem cell therapy. We get, while you're sleeping, we get the blood draw and we culture the stem cells from that to help make sure that we get the implants secure and we can load them that day. This is our smile design room. So this is where we try in the bridge and we make sure that it flows and it fits really nice with your face. This is our imaging center where we get a 3D image. Most of the time you have to go outside the office to get that CAT scan. We can do it right here so you stay in the office. We seem to attract two types of patients. The first type are the ones that are headed for dentures. Their teeth are loose, they've got bad breath, things are going bad, and they're doing everything in the world they can to avoid getting dentures. They saw their grandparents have dentures and they're doing anything they can to get there. So they come to us and they can avoid the dentures and they can get a set of teeth in the same day. The next group are the people who are already in dentures, and we'd sure like to help them. They're the ones that we can help the most. And some of the reasons they don't come in are, well, the first reason is they've been through a lot with their teeth already. If you're in a denture, you probably went through this time frame where you were having teeth taken out, you were having painful dental appointments. Every time you came in, it was something different. You're a crown, a root canal, a filling, an extraction, a partial. And to be honest, when the teeth finally came out, it was a relief. The battle was over. You just had them out, and the painful dentist appointment was all done. And you had your denture put in, and it wasn't great. It had that palate, and it was tough to get used to, but humans, they know how to adapt. And you got used to it, and that was your life, and it was a relief from the dental days. But things are different now. The kind of foods that you can eat again with these teeth, it's amazing to eat the foods that make us healthy again. You can start eating salads again with the crisp things that you normally couldn't eat. A lot of people go to the doctor and they're told, hey, you got to eat more fiber. You got to have more of these. You got to have a healthier diet. When you're in a denture, you don't really have a choice. You kind of have to eat these pasty, mushy things. You don't really tear and grind up the food. You just kind of mash it together, and if it's already pasty, it goes down easier. That's not a very healthy diet. That's a lot of the reasons why we have trouble staying fit and eating right is because of the denture. When you get this new set of teeth, you can eat anything. Another reason why these denture wearers don't come in is they think they're too old. How old is too old? I have a lady who's 104 coming in today. Her daughter brought her in because her partial finally broke, and it was hurting her, and she just wants to eat. Her kids bring her these cakes and these different foods with this nut bread on it and these different casseroles, and how sad is that she can't even eat them now? So what I'm gonna do for her is I'm gonna give her a couple implants in there, and we're gonna give her a set of teeth, and she can eat whatever she wants. And one of the main things for her is she can start to become healthier. She's not feeling healthy off of the foods that she's eaten without her teeth. So she can start to eat and enjoy foods again that she couldn't before. Look, you owe it to yourself to come by. If you're headed to a denture, or you already have a denture and you're just wondering what your options are, just come by and meet me, meet my team. It's a free consult. You've got nothing to lose, and find out what your options are. It's faster than you think, and it's more affordable than you might think.
My teeth were horrible. They were in such bad shape. I had broken bridges, I had abscessed teeth, I had cavities that wouldn't quit. And I decided that I wanted to have something permanent, not like dentures, to be able to live the rest of my life out in joy and not in pain. And my big deal was pain. I was in pain all the time. And then I went online and I looked up all the options for permanent teeth rather than dentures, and I found Dr. Keller, and I read about him, and I read the reviews on him, and it felt perfect to come here. I have temporaries right now. I'm in the first stage of this, and they are beautiful, and I smile more than I have in 20 years. And when I smile, it makes me really feel good about myself, and I have lot more self-esteem now.
Already you're looking so much younger, but I know that once your jaw relaxes even more, that your cheeks are gonna thin out, and I'm gonna need to adjust the next set. So this is just your temporary sets.
The first time I really looked at my teeth was the next morning after I'd had my first procedure. I was shocked. I thought actually there was no way my teeth looked that beautiful. I couldn't believe it. So when I came back, I said, "Oh, I love my teeth. Thank you so much." And he said, "That's not the permanent teeth. You're getting some more." I was like, "Oh, wow, that's amazing." I had so much problems in my mouth, and for him to be able to fix it was, again, I can't even explain how wonderful he is. And he's such an artist. He looks at your face, he looks at where he wants your jaw to be, and I had a significant overbite, and boom, he just fixes it. So he's magic.
Since I've had this procedure done, I've had lots of compliments on my smile. I love to eat cashews, I love to eat peanuts, corn on the cob in the summertime, and I couldn't eat that stuff anymore. It was hard to pull. So when I had this procedure done, I eat all the foods I love, and it makes me happy.
One of my favorite technology toys that's changed everything for me is the 3D printer. Being able to print the surgical guides the same day in the same position we plan the implants, the precision that we get from this, the stability of the implants, that's how we're able to do this in one day. The 3D printer makes things extremely fast because we don't have to send out to a laboratory to get the surgical guides. On the computer where we decide the implants should go, this prints out a guide that tells us exactly where to put them so we can do it fast and with great precision. This is how we're able to put the teeth on the implants the same day so that you can walk out and chew your favorite foods that night. I've scoured the earth to find the latest and greatest in implant dentistry. The types of implants that we do, the metal-free implants, the ceramic zirconia implants. Around Seattle, that's very popular to be holistic and the thought of having metal-free. I hear this all the time. I don't have enough bone for dental implants. I've been in a denture for 30 years and there's just not gonna be enough. They're gonna fall out if I have this done. I haven't met somebody that we can't help yet. With today's technology, we can get the implants in there solid, and it's usually just 4, and we can get you a set of teeth that'll be permanent, that are they're gonna last a lifetime. Yeah, I mean, the smile, of course I'm a dentist, so I'm gonna say that the smile is really, really important, but if you think about it, we cover 95% of our body with our clothes, so the only part that you really see is your hands and your face, and the smile, it's right at the center of your face. And if your teeth are starting to go and you're not proud of them, you might not be smiling, or you might hold back a little bit. They might just think that you're shifty, or you're not a happy person. When we see people light up after we do this, and when they start to like their smiles, it changes everything for them. They become a new person. A lot of times they get a new job, their relationships improve. I had one lady, Agnes, when we finally did Walter's teeth. She said, "You know, you brought my husband back. I mean, he's smiling and he's laughing again. And the only thing that changed is he wasn't embarrassed of his teeth anymore."
People are amazed, especially family, people you're close to that, saw you going around, doing this, or, avoiding eye contact, smiling and stuff. And it makes a big, big difference. I mean, people talk about it all the time. If I would have known how easy it was and how well the results ended up being for me, it would have been something I made the choice to do many, many years ago. For me, I would just say, if you're unhappy with your smile, you're uncomfortable with being able to eat foods that you really love, I would just get this done. I wouldn't wait tomorrow, I would do it today.
My mother's 102 years old, and we were very nervous about doing any procedure on her. And she's in the back room right now getting her new teeth. She's very excited. She's always kept very good care of herself. And so I'm very excited about her getting some new teeth so she's able to chew and stay healthy. She deserves to have the best quality of life she can have for the rest of her life. If there was anybody that I was going to trust my mother to, it would be Dr. Keller.
I broke a couple of teeth and I didn't want the metal titanium implants. And so I looked around in the area, and he was the only dentist in the area who did the zirconia implants. And so once he did the 2 zirconia implants, I told Dr. Keller I wasn't really happy with my smile. And that's when he did the complete smile makeover for me. I actually get compliments for my smile now. My self-confidence is so much more now with this smile and Dr. Keller's work.
Here's another patient, and she had a severe periodontal disease. These teeth were just loose. When she bit down, they were coming forward. She had a metal allergy, so this was a very tough one for her. She had no idea what to do, and then she's getting ready to just succumb and finally get the dentures that she knew she was going to have. And one last shot, again, she Googled me and found metal-free implants. And so there's some debate over whether zirconia has metal or whether it doesn't, but the point is that they're white, and people that have traditional metal allergy, they can accept these. And so these, we did 4 metal-free implants on the top and 4 on the bottom, and we had these teeth out and put this new set of teeth in on zirconia white implants. So she can eat whatever she wants now, and now that she's got her permanent set of teeth, she just comes in here every 6 months like everyone else, and she's back in the system just for cleaning every 6 months. I gotta show you this. It's not just lip service that we do it all in one day here. I got a United States patent for the technique I invented, where we use the stem cell therapy and the digital scanner to do it all digital. So we literally, the day you come in, we scan your teeth, we have the bad teeth out, or if you're in a denture, we use that as a guide, and we put in the implants, and you leave with teeth that day. Really, really exciting stuff. We're doing some innovative things here that I'm really, really excited about, and you got nothing to lose to come by and at least meet us and see what we can do. So I have this patient, Margaret, and she's probably about 75 years old, and she meets Earl. And the dating is going well, but she has a dirty little secret. She has a denture, and he doesn't know about it. And so she's trying to hide this, and they go on a cruise, a Caribbean cruise, and they're out there, and they're having the margaritas, and they don't realize how many they have, and she's had about 5 or 6 of them. She tells me she ends up getting sick, and she over the edge of the boat, and she loses her denture. And when she comes back up and feels it just goes in right there, her lip is just collapsed. And Earl doesn't know, and so she's trying to think of everything she can do to hide it. She winds up going back to the room, and she just, Earl sees her for the first time, and it doesn't look like her. She's so embarrassed, and she thinks she's gonna lose the guy that she just met. They both come to see me, and we're able to get her a set of teeth that don't come out this time. And just 4 implants, we give her something, and she can toss her cookies on the cruise ship anytime, and her teeth are gonna stay in because they're part of her now. She doesn't ever have to worry about Earl seeing her that way again. In today's day, nobody should be wearing a loose-fitting denture anymore. With today's technology, there's no reason to anymore. It's so easy to get this in one day.
So my teeth during pregnancy started chipping and falling out and cracking. And I was told I needed to get all my teeth extracted and dentures. But I was 25 last year, and I didn't want to get dentures. It was a nightmare. The thought was a nightmare to have something in your mouth that came out and in, and I'm only 25 and I still have a whole life ahead, and I wanted to have a normal life. So I Googled, and the first result that came up was Shawn Keller, and I saw this new technology that he had where you actually could have implants and bridges in, so they were just screwed in, they didn't have to come out. They were just like your own natural teeth. Now I have these, and they're amazing. They look better than the original smile I had. And I'm just so thankful because that was the worst thing that happened in my life, and it changed to be the best thing with Shawn Keller. I have a beautiful smile. I can actually smile and open my mouth and talk to people and go out into society. And the most important thing is also that my son can see my smile, because when he was actually first born, I know he was a baby, but still, it's just, I would never want him to see that condition I had. And this is amazing. I can eat better, I'm healthier. It's changed my life.
Throughout my entire life, I had yellow teeth from tetracycline when I took as a child. No matter what I did, they would never get white. And I had a lot of root canals that started to abscess as I got older, and I started to get into pain. Found Dr. Keller, had a metal-free implant put in. I had porcelain crowns put on my teeth. I am smiling all of the time. I travel for work and I'm constantly stopped in the airport with people telling me how great my smile is. I couldn't be happier.
So this is Manuel. He was very, very unhappy with his denture. It was so uncomfortable he never wore it. And rubbing on the gums the wrong way and it hurt, and he just was doing everything he could to avoid the complete denture that covered his whole palate. And so he Googled us, and with him, we gave him a full set of beautiful cosmetic teeth. They don't come out, they're fixed right in place. And yeah, I mean, he loves his smile and he can eat whatever he wants. Now, people think that he looks, do you think he looks more sophisticated here? He looked younger here. He looks, he looks more, he's more handsome here.
When they get their permanent teeth, that day they're changed. They just able to enjoy life back. They're able to go out and meet and socialize with people. They're able to possibly even get a job promotion. They love the fact that they're out and about in society and they can smile, they can eat, they can be healthy again.
So we seem to attract two types of patients for dental implants. The first type are the ones that are told that they need to have their teeth out, that they're headed for dentures, and they want to keep their teeth. They don't want a denture like their grandma has. They're doing everything they can to avoid that. And so they come to us and we can have their teeth out and have the implants in, and they get a full set of teeth that don't come out in the same afternoon. So they walk out of here with upper and lower teeth and they're good to go. The other type are the people who are already in dentures, and especially the lower one. It's having trouble staying in and it's giving sore spots, and they can't eat the food they want. So they come in here, and in the same afternoon they get a full set of upper and lower teeth that are attached. They don't come out, and they have that in one afternoon. And so they come in and they're denture free in one day. I could go on and on about the transformations we see. I have different patients that I connect with along the way. Ken is one of my favorites, and he and I both love Hawaii. One of his main things is he loves the fresh fruit that they have there, the taste of the pineapple, especially when you go to the Dole plantation there and you take that tour, and at the very end of it they give you these spears of fresh pineapple. And he always had to order kind of the pineapple mush because he had these loose teeth and a partial that wouldn't let him eat it. So he found us and he came in and we got him set up with a set of upper and lower teeth that don't come in and out, and he can eat whatever he wants. So I mean, I'm thrilled to see my phone go off and I get a text with a picture of him just biting into that crisp pineapple spear, and man, I know how those things taste, so I can only imagine being there and tasting that pineapple with him. So you know, to eat the foods that you like to again, that you enjoy again, it's a huge part of this.
Yes, so when I first saw my smile, I was amazed. Actually, it looked just like normal teeth, and I didn't even have thoughts like people would tell it's fake or anything. And everywhere I go, people are like, "Wow, you have such a beautiful smile. What's your secret to your beautiful smile?" And I'm just like, I just have a beautiful smile. You know, it's great. I mean, I get compliments a lot. I never had those compliments with my original teeth, but now I really have compliments everywhere I go. So I think I've smiled more than I ever have in my entire life. I think no one, regardless of your age, deserves dentures. These are permanent teeth. I think everyone should have teeth, not dentures.
I smile in photos more so now than before. Yeah. I really liked Dr. Keller's care and attention to not only the science of the work, but also the artistry. And it was the best combination I could find of the scientific advancements and the artistry.
Oh, I wish I would have done it years and years ago. I really didn't know how bad the problem was until I have seen those before and after pictures with my smile. Very first time I saw my smile, I was completely amazed at the difference in just the way that my face looked. I thought I would have whiter teeth, and I actually look about 10 years younger.
This was the best investment that I've ever made on myself. When I first met Dr. Keller, enthusiastic, amazing. He wants to help you. He made me feel good about myself again by having me get the smile that I love.
Looking good. Let's take a look here. Oh, he was already so manly before, but now look at this jawline and the chin. Yeah.
I'm very happy. Thank you so much.
Yeah, my pleasure.
The best treatment is that they get all their treatment done here in our office. And we do our implants, we do our permanent teeth here in our office. They don't have to go anywhere else. We don't outsource them to other dental offices. Everything that Dr. Shawn does, it's done in our office.
Traditional dentures are out. Getting teeth that are part of you that are fixed are in. They don't come out. It's like having your teeth again. If you've been told that you need a denture, or there's another type, your teeth are, you're struggling with your teeth and you've spent a fortune already going in and you're messing around having crown, root canal, you've been told you need an implant here and you've just been putting it off and you didn't know you're really headed for a denture, this option might be for you too. Just end all the appointments and wasting your money on teeth that are going to eventually come out anyway. You could have this set of teeth on just 4 implants, or if you're in a denture right now and it's doing okay, but you're just looking for something better, you owe it to yourself to stop by and see what we can do for you.